Guys, do you see anything? Have you ever been like knelt down by your parents as a child and they're checking you for ticks after a hike? Or they were frantic checking their dogs for ticks between their toes or behind their ears? They're looking for ticks because they can transmit Lyme disease. I'm Dr. Lindsay Butzer, a small animal veterinarian, and in this video, I'm gonna tell you guys everything you need to know about Lyme disease in dogs. So I love educational videos, and I've prepared some slides for you guys that are gonna tell you everything you need to know. How it is transmitted to your dog, what their clinical signs are gonna look like, how to treat it, and how to prevent it. So hang tight, you're gonna learn a ton. Let's get into this. What if I told you guys, as I was making this video, I got a text from my friend's mom who just got diagnosed with Lyme disease. So here is a photo of her ankle where she was bit by 2 ticks, and there is that classic bullseye appearance within her skin. So humans, 90% of them, get really sick when they get Lyme disease. But out of the 1 million dogs that test positive for Lyme each year, only about 5 to 10% of them get really sick. So Lyme disease is caused by a bacteria called Borrelia burgforferi. Sounds like an expensive purse or something. And it's transmitted by a tick that takes a blood meal on a dog for over 24 to 48 hours. This spirochete, a squiggly bacteria, gets into their skin and bloodstream through the tick feeding on them. You may have heard of people getting a bullseye rash on their skin, like that photo I just showed you, but with a dog's fur coat, we don't always see this from an initial tick bite. Lyme disease is found in all 50 states, but it's mostly found in the northern, Midwest, and eastern states of America. And a fun fact is that a lot of celebrities have had Lyme disease, like Justin Bieber, Kelly Osbourne, even Avril Lavigne. How are they getting this? You think they're hiking up there in their chateaus and then going through the woods and having like some great experience and then all these ticks bite them or something? Anyways, they're still alive and they're doing good, so your dog's gonna be okay too, I hope. Let's keep going. The tick that transmits Lyme disease are the Ixodes ticks, also commonly called deer ticks or black-legged ticks. And these ticks like to hang out on leaves and they're just waiting for a deer or a dog to brush by and they jump onto them to take a blood meal. So what does a sick dog with Lyme disease look like? Now let's go over to my chart and look at what organs it likes to affect. Keep in mind that Lyme disease can be tricky. It can have a delayed onset with symptoms appearing in dogs 2 to 5 months after infection. And up to 90% of dogs may show no symptoms at all and never even get sick. And this is totally different for humans, where 90% of them get sick. It's flip-flopped. But when they do get sick, Lyme disease likes to travel to the joints and the kidneys. These are the 2 things you need to know. So common symptoms include lameness, something called shifting leg lameness, where they might be limping on one leg and then the next day limping on another leg. Owners might also see swollen joints or their painful joints. They can have a fever up to 103.5. They could be lethargic, have appetite loss, which means they stop eating. They can even start to lose weight and vomit. In severe cases, Lyme disease can lead to Lyme nephritis, a kidney condition caused by an overreactive immune system. This can result in kidney damage and glomerular disease, which can be fatal. And sadly, I have seen a lot of these cases of Lyme nephritis while I was on my clinical year in Massachusetts. With a simple blood test, your veterinarian can test your pet for Lyme disease using the IDEX SNAP 4DX Plus test. In addition to Lyme, it also tests for 3 other vector-borne illnesses: Heartworm, Ehrlichia, and Anaplasma. IDEX then offers the Lyme Quant C6 test, which measures the level of antibodies that are produced when a dog's infected, the most accurate and confirmatory test. This Lyme Quant C6 test tells you if there's an active infection and if treatment is needed. And before we move on, I want to thank this video's sponsor, which is IDEX. I'm going to put a link in my description below so you guys can click on it and learn all about them and how they make our pets' lives better. before I tell you the treatment, your veterinarian is always gonna check your dog's blood work to make sure that their kidneys are functioning okay. They're also gonna check their urine to see if there's any protein in it to check for that disease I mentioned called glomerulonephritis. Say that 10 times fast. So blood work is crucial to see how your dog is doing overall with the disease. So the treatment involves an antibiotic called doxycycline. So they're gonna take this for up to 4 weeks and maybe longer to cure them of Lyme disease. Your dog will also need to be retested at least 1 year later or sooner if your veterinarian recommends that, to make sure that the Lyme disease didn't come back or that they got re-bit by a tick, because these dogs that get Lyme in the first place might be living in an area where they're going through the woods a lot, or it's right there in their backyard. So you heard me joke about this in the beginning of the video about tick checking your dogs or your kids for ticks that carry Lyme disease, but that is something you really do need to do, is get the ticks off of them. Also, using tick prevention, such as any of the products that you could order online that will kill a tick before they can transmit the Borrelia burgforferi bacteria into your dog's bloodstream, because it'll kill the tick hopefully within 24 hours before they can transmit it. And then the other thing is vaccines. You can vaccinate your dogs against Lyme disease starting at 8 weeks old, and then boost this every 2 to 4 weeks later, and then vaccinate them yearly for it if you're worried about Lyme disease in your area. All right guys, I hope you learned a ton about Lyme disease, and if you have any stories yourself about your dog that was diagnosed with Lyme and maybe they recovered, I would love to read those comments below for other worried pet parents that are going through this right now. Maybe their dog is hospitalized and their whole family is sad, so a success story would be something great for my followers to read. Like always, smash that subscribe button, hit the thumbs up, and I will see you with a new video next week.